That's morning, Kathy.
Good morning.
Were your ears ringing? Susan Buckles just sent
Phil Magnus.
There you go. That's morning, Kathy.
Good morning.
Disappointed that it wasn't canceled.
Yeah.
Like we have no school in October either.
You don't today. Yep.
I really, first, thank you for allowing us to start a few minutes late. I know the travel is not fun today, and so there were people wandering in, and we wanted to just give it a few minutes so we didn't have to kind of start all over. And I felt like, you know, we usually start on time for the people who are on time, but today everyone gets a pass because the roads are terrible. So a big thank you to those of you who came out, and it looks like we've got probably most of the people who RSVP'd, which is awesome. So I'm Diane Pickles from M&R, and I am a consultant working with the Department of Public Health on the Community Engagement Initiative. And I'm going to really turn it over to Leah, Susan, and Mike, who are going to lead the session. I'm going to play Vanna White on the computer and then be taking notes. But there is a handout that was also circulated by email, so you may already have it, but we wanted you to have it in front of you for today, if that is useful. And with that, I'll turn it over. You guys want to introduce yourselves, and we'll go from there.
Good morning. Is it still morning? I think
It is.
It's hard to, like, and I don't know, is it Monday? I don't even know what day it is. I'm Leah Susan Ojamaa. I direct the Division of Prevention and Wellness at the Department of Public Health. I see lots of friendly faces. So in my division is all our chronic disease initiatives. And along with Mike, who will introduce himself, we are co-chairing a community engagement work group at the department. Mike?
Good morning, everybody. I'm Mike Coughlin, the department's accreditation manager. I'm probably going to keep my speaking to a minimum this morning, a little hoarse. Community engagement is an important part of national accreditation, which the department is pursuing. So that's why I'm involved with it. Glad to see you all here this morning as well.
So we have a brief presentation for you, but the majority of what we're here to do is to elicit some feedback from you around the principles, and hopefully you all have a copy of the draft document. Because this is a listening session, so that's our goal, is to elicit that. So what do we hope to accomplish today? To share a draft of the Coalition Engagement Principles document, seek your thoughts, reactions, comments, and ideas, and be able to bring back to a small DPH planning team thinking of community vendors and partners to be incorporated into the final document. So why are we here? What's this all about? I'm going to lead with one thing. This is not a bidders conference for an RFR we're putting out for coalition. I'm leading with that because it seemed to be, from our listening session in Boston on Monday, a little bit of confusion that we were here to talk about something we were putting out for funding. So I'm leading with that's not why we're here. Okay, there is not an RFR that is out there around coalition. So maybe you didn't even think that, but I figured, you know, lessons learned from 3 days ago. Is that when it was?
Yeah.
As it was
right
beginning
before
to-
the storm.
As the storm was beginning to fall. So why are we here? What's this all about? DPH must encourage its grantees to participate in community collaborations. Historically, it met that need by requiring grantees to participate in Chenaz. DPH seeks to develop a more flexible framework to empower communities and grantees to decide on the best approach for them. So in addition to Chenaz, because that's, you know, again, I'm going from some of the comments from Monday, Chenaz are one of the coalitions that people may choose to continue to work with, but the intention of this is to also give some flexibility for communities to make the determination of what really works best for them. And so some DPH programs require specific types of coalitions with more defined membership and agenda. So there's also grants that we put out, and that's not what we're here to talk about, but there are grants that we put out that require the development of a coalition or a partnership. So that is also different from this. This is really meant for, hey, I come to Worcester and I get to see Judy Kirk. I'm sorry, last in the past for me. And I have to highlight that she's walking in late. Sorry, Judy. It's only me and your friends. Some DPH programs we fund, and I always use my own experience, so I'm involved with Mass in Motion. Part of Mass in Motion is to develop a multi-sector partnership. So we already have a requirement there. This is for requirement of programs that DPH funds that asks for people to partner with those in their community through a coalition or a partnership. Okay? So that's what this criteria is about. So why DPH encourages community coalitions, partners to engage in community coalitions? I'll lead with that. We think it's the right thing to do. I think it's the important thing is that people should not be working in silos. We should be working in collaboration with each other, across issues, across disciplines, all of those things. But so that's my first and foremost, is I think it's because it's important to recognize that not only are there reasons, specific reasons, we also think it is the right approach. So accredited health departments are now required to engage with the community in identifying and addressing the health problems through collaborative processes. So as Mike mentioned, he is the accreditation manager for DPH. The department is going through, so FAB, you can see here, FAB, just add to our acronyms, is Public Health Accreditation Board. So that is a requirement that we do collaborations, and there's also local governments that are also, local public health departments who are also going through accreditation facility. I know here in Worcester, and I know there's others across Commonwealth. So this is really part of accreditation. Coalitions provide a forum for partners to exchange information, share resources, and enhance capacity. While DPH must explicitly encourage coalitions, the department wants to empower communities to make their own decisions. So again, going back to our initial thing, we've had this requirement that was based in the CHNAs. In this new criteria, we want to establish to give a little bit more flexibility. If the CHNA is the strong coalition and partnership that works in your community, that's great, because we know that that is in a lot of areas the case. But we also wanted to provide some flexibility for people to make determinations, and that's what this is about, determining what type of coalition based on meeting certain criteria. So how we got to today, I don't know why my things are all flip-flop. Approximately a year ago, staff and community listening sessions were held to gather some ideas. A community engagement work group was created at the department to continue the work redefining our community engagement efforts, and that's something Mike and I are co-chairing. We've had the support of Diane through M&R Strategic Services, and it is a cross-bureau work group. There was a lot of us at the department who do a lot of work with community partners and community coalitions, so this was really bringing the players together at the department who have different experiences and different groups that they work with, so it has been a really great opportunity for us to collaborate on this. And that group is going to continue beyond this, the development of this document. The plan is for have that group continue, because there's definitely, just coming up with the criteria is not where it ends. We want to be able to continue the work in cross-bureau collaboration. And I know the folks on our community partners are always happy to hear that we actually talk to each other. Sometimes in the department, I know that gives off an impression, right? But we actually do. And this is an opportunity around community engagement to continue to do that. The work group developed a draft set of principles, set of definitions, and a principles of engagement document for the department. And we have conducted staff listening sessions in December. And so now we're conducting the 3 community listening sessions in January. So we got feedback from staff who hadn't been part of the work group in December. So this is an opportunity for us to also get some feedback from our vendors. Now I'm going to turn it over
I'm going
to Mike.
Very briefly go through a summary of the document that we sent out in advance and distributed to you again this morning. We did some research over the summer, and I thought we were going to be able to identify some definitions that would distinguish between coalitions and partnerships and alliances, but it was quickly apparent that that wasn't going to be possible. Those terms are used pretty interchangeably. So for the purposes of our discussion and for the draft principles, we reached consensus that we would call these collaborations coalitions, and we would use the simple definition that you see up there on the top line, an alliance for combined action. And the principles are broken up essentially into 2 sections. The first are criteria that we expect all of the coalitions that we formally engage with to meet. And then beyond that, and there's a second slide that I'll show after, some additional beneficial characteristics that we encourage coalitions to reach for, and will provide them with technical assistance to try to meet. So the minimum requirements, any coalition that we work with should have a statement of purpose. It could be a mission statement, a set of values, something formal and written that speaks to what that coalition is all about and describes the work that they do. The only specific criteria that we're putting forward that we would require coalitions to work to be consistent with, at least, is a value, a part of our mission that we have stayed behind for many years, and that is to work to reduce disparities among residents in the Commonwealth, health disparities among residents in the Commonwealth. The work of the coalitions that we collaborate with should be consistent with the State Health Improvement Plan, or the SHIP. That's what that acronym stands for, if you're not familiar with it. Some of you probably did work with us, attend some of the working sessions that we held in 2013 and 2014 to draft very extensive, essentially it's a work plan to improve the health of the Commonwealth. It's available for you to view on our website. There's an accreditation page that you should be able to find pretty easily, and it's attached to that. It's broken down into 7 health topic areas, and it also has a strong section that describes the importance of improving public health infrastructure. It covers a great many of the public health issues that we're all interested in. It's not meant to be exclusive. Those of you who work on public health issues that don't see them explicitly addressed in the SHIP don't need to be concerned that we do not allow you to collaborate with us. But we're looking to be sure that folks that we work with are doing things that are at least consistent with and in agreement with what is in the SHIP. Coalitions should be familiar with and utilize data. Evidence-based practice has become such an important part of our field over the last generation or so, and we want to see some evidence that the work that coalitions do is based on health status data in the community that they're serving. Define leadership. Who's in charge? Who makes the decisions? Beyond that, a defined structure for making those decisions and a role for the individual members of the coalition to play. How it all works, how anyone in that community, anyone who's a member of a particular coalition, has some defined opportunity to participate in decision making. There could be an annual meeting, there could be a mechanism to poll members to give them some opportunity to participate in decisions, and at least some of the big picture items, but some spelled out way that the coalition engages its membership in the community as a whole. So that's a pretty pared down, a pretty simple list of criteria that we want to see any coalition that we formally collaborate with meet. Beyond that, you'll also see in the document some additional characteristics, some additional elements that coalitions might strive for, that have beneficial characteristics. Some of them expand on the list of required criteria on the previous slide. Operating guidelines that promote transparency and trust. So a set of bylaws that spell out even more clearly how decisions are made and how individual members of the coalition have a chance to participate. And a governance structure that implements those guidelines, those bylaws, whatever they might be called. And widespread participation in the governance structure. So again, following on the same track, what are the opportunities for all members of the coalition to participate? They should be spelled out very clearly. I think on the previous slide, I forgot to mention the bullet, I think, but on the previous slide I said we wanted membership that is reflective of the community. Beyond that, it should be reflective of the diversity of the population, both that it's serving and in the Commonwealth, both in terms of racial and ethnic status and organizational participation, and also involving key stakeholders in the community. The various sectors, we'd like to see more opportunities for the business community, for example, to participate in public health initiatives, and that doesn't always happen as effectively as we'd like it to. A clearly established communication structure. How is the coalition communicating with its full membership in the community that it's serving? Newsletters, an active website that's well promoted and visible in the community, regular public meetings, and lots of other opportunities, electronic communications, phone trees, whatever they might be, but some established mechanisms to get the word around about the work that the group does. continuous recruitment of new membership. We don't want to see the same 5, 10, even 15 people over many years making all the decisions and holding them closely and being exclusive and not bringing in new blood. The lifeblood of any community relies on getting new people involved, new perspectives, inviting newcomers to the table and giving them an opportunity to get involved, and we want to see that happen as much as possible. A realistic plan for fiscal sustainability. We see coalitions come and go based on funding cycles for specific grants, and we understand how that happens. But we want to encourage coalitions to think about how they can sustain themselves financially over the long term. And the final bullet, effective utilization of any other assets in the community involving links to key decision makers, involving staff and volunteers, whatever else it might be that's unique to that community is that they can take advantage of to promote the work is to be encouraged. So where are we going from here? The work group that we've been telling you about, the latest has been telling you about, is going to update the document based on all of the feedback that we get. And there'll be opportunities to provide written comment if something comes to you after you leave today. And then the final document will go through the usual agency decision-making process. And at some point, Leah Susan and I will probably have to brief the new commissioner who starts next week, so she doesn't know anything about this. So that may affect the timeline to some extent. And then over time, it won't happen overnight, we will begin to operationalize these guidelines in some specific ways. Two of those mechanisms are spelled out in that final bullet. RFRs that are issued, whether they explicitly require collaboration or coalition work, or if they just require that the applicants be linked to an existing coalition, those guidelines will be followed in terms of that coalition involvement. And the determination of need factor 9 process, which is, if you're not familiar with it, it's a healthcare organizations that apply to DPH to get approval for capital spending to build a new wing on their hospital, whatever it might be, are required to set aside a relatively small, but when the numbers are that big, it's still a fairly significant amount of money made available for community improvement projects. And the organizations that seek to make use of those funds will be required to meet the criteria that we're talking about today. So I should definitely stop talking now and rely on Leah, Susan, and Diane to facilitate the discussion. Thank you all for coming, and we look forward to hearing your comments for the rest of the session.
As Mike said, there's also, I'm going to give you my email address. Anything that you have additional comments or ideas that come to you, jot down my email. You can email it to me after the session, or if anyone can't be here today, they can email comments in. And as we go around, maybe people can just say their name and where they're from for people to know who you are.
So this is a good, Mike's voice is going, but it's perfect because we've really done our presentation. This is all about hearing from you. So really, we have some questions to pose, and we're, to elicit some feedback. So first, as you see this, what are your thoughts about DPH developing a set of definitions around coalitions and minimum criteria for coalitions we engage with? So what are some of the thoughts that you had as you see this document? Tina? And say your name too, because I know some names, but Tina?
So I'm Tina Brusowski, and I coordinate the Central Mass Tobacco-Free Community Partnership, which is a DPH funded program for the Central region. And I work in collaboration with many coalitions and alliances and CHNAs across the Central region. It's great that you guys are coming out, obviously, and soliciting input from people who are working out in the field. One of the things over the years that I've really been interested in, and I remember when John Auerbach went out and did some listening sessions when he became commissioner, was around the CHNA and the DON funding. And if the interest of the state is to work on health disparities, the DONs are not funded according to health disparities. The Chenaz, especially now, because the DON is really pulled out of the Chenaz, there's hospitals in regions that have low health disparities that are getting great amounts of money because of the building and the machines that are put into the hospitals. And there's small community hospitals in regions that I work with here in Central Mass that have virtually no money and rely solely on collaborations and alliances that are in the communities and fundraising, basically. So I think that's a major problem. I would be interested in what other people think about that. And do you think the state sees that? How does the state view it in that way?
See, I'm going to turn back on you because, just listen. But I want, how do you feel this and developing these principles may help that process? And some of the things that we would want to take back, because there are other DPH staff in the room here today who have other roles that they have, and specifically in some of that. So if you can talk about how do you think this criteria may help address some of what you just raised, or does it?
And I would say that unless it addresses the inherent disparities that are in place with the resources, I'm not sure how it will enhance, obviously, collaborations, but I'm not sure how it addresses the problem of the DON funding.
So it's how it gets operationalized.
Right.
Okay. Diane's contact information is up there, so again, if you guys think of something on your way back to Fall River, that's Diane's email address, and we will take those through the 15th. So thank you, and safe travels, and get ready for a little bit more snow tomorrow. I don't know where it's going to go.